African Americans have been dealing with disparities in the healthcare system for centuries. But rather than just talking about those disparities, let's talk about how those disparities are impacting African Americans that are willing to take the COVID vaccine today. There have been lots of articles written and discussions had regarding why some African Americans may hesitate to take the COVID vaccine. I even released a video that talks in detail as to what some of those hesitations are and how we got to this point. Although there are some African Americans that are hesitant to take the vaccine, the current narrative states that most African Americans are unwilling to take the vaccine. Did you know that the majority of African Americans want to take the vaccine? Based on the polls taken and the tests conducted, the conclusions were that 2/3 of African Americans want to take the COVID vaccine. That's 30 million African Americans wanting to take the COVID vaccine. Unfortunately, the vaccination rollout has followed the same pattern of racial disparities as the healthcare system. As of early to mid-January, only 12 states released vaccination data that separated race from ethnicity. Of those 12 states, the data showed that white Americans have been vaccinated at a rate 2 to 3 times higher than those of African Americans and Latino Americans. At that time, 4% of white Americans have received at least their first dose of the vaccination, where only 1.9% of African Americans and 1.8% of Latino Americans have received at least their first dose. All those studies show that African Americans and Latino Americans die at 3 times the rate than white Americans of COVID, and they're hospitalized at 4 times the rate of white Americans. White Americans receive the vaccination at 2 to 3 times higher rates than those that are impacted by the virus the most. It's well established that African Americans and other minority groups within the United States experience more illnesses, worse outcomes, and higher premature deaths than white Americans. Now, suppose you're one of those few African Americans that are allowed to take the vaccine, and you experience one of those negative outcomes from the vaccine. The first disparity you're going to experience is in your ride to the hospital. A 2012 study found that African Americans were more likely to be taken to a low survival hospital. That study also found that African Americans and Hispanic Americans were less likely to go to the same hospital as white Americans, even when they lived in the same zip code. Now, that's despite the national requirements for EMS to transport patients to the nearest suitable hospital. A 2019 study from Boston University focused on EMS transportation disparities. In their study, they found that white Americans were taken to the reference hospital, which is the hospital they should be taken to, 61% of the time, while African Americans were taken to the same hospital 5% less. They also found the disparity to be true in all geographic areas, so suburban and urban areas alike. They noted that EMS transportation would travel significantly further to bypass the reference hospital when transporting African American patients. So the question is, where are African American patients being transported to? Studies found that African American patients are more likely to be transported to safety net hospitals than white patients, even when they live in the same zip code. Safety net hospitals are hospitals that accept people for whatever the reason they come in. Whether you have insurance, whether you can pay, can't pay, regardless of your reason for showing up, they accept you. Safety net hospitals compared to non-safety net hospitals rank lower in overall patient care and patient experience. So all that to say is if you're African American, you're more likely to go to a hospital with a higher mortality rate, less overall patient care, and less overall patient experience than your white American counterparts. And that's just how you start the healthcare process. A study reviewed over 15,000 patient visits to the hospital that was related to ACS symptoms. Now, ACS symptoms are important because those are the same side effects that people have experienced after taking the COVID vaccine. Now, those side effects include nausea, muscle joint pain, headache, fatigue, and the like. The study found that African Americans that went to hospitals with those same symptoms had to wait 31 minutes before they were seen by a doctor, while white Americans with the same symptoms only had to wait 22 minutes. That means African Americans had to wait over 35% longer when going to the same hospitals with the same symptoms. In 2013, the percentage of African Americans who needed care right away, but sometimes or never received that care as soon as they wanted, was significantly higher than white Americans who needed care right away and sometimes or never received that care as soon as they wanted. From 2002 to 2013, those numbers had no statistical change. When you're finally taken to a bed and seen by a doctor, many times they don't believe you, they don't include you in the diagnosis, they give you less pain medication, and there are even reports of doctors saying that their staff feels intimidated by you. But rather than going through all the stats and studies that support these claims, I want to introduce you to Dr. Susan Moore. Dr. Moore was a graduate of the University of Michigan Medical School. She was also a family health physician. In December of 2020, yes, just a couple months ago, Dr. Moore was being treated for COVID-19 at the University of Indiana's Health North facility. During her treatment, she felt like she wasn't being treated properly, so she tried to advocate for herself, to no avail. She begged doctors to give her more pain medication. She even pleaded with them to believe her in her claims, and they fell on deaf ears. Dr. Moore, after not being able to find anyone to support her claims and support her advocacy, she went to a patient advocate and requested that they help her. They responded to her with, there was nothing that they could do for her. After exhausting all options, Dr. Moore requested that she be transferred to a hospital that would support her claims and help her with all her pain that she was going through. The doctors responded by telling her not only would they not transfer her to a different hospital, but that she might as well go ahead and leave their hospital. Rather than telling you all that Dr. Moore said and how the situation went down, I'll let you hear it from her mouth.
Here at IU North, yesterday, a Dr. Bannock, Bannec, wanted to send me home. You know, at that time, I'd only received 2 treatments of the remdesivir. He said, you don't need it. You're not even short of breath. I said, yes, I am. Then he went on to say, you don't qualify. I must have, because I've gotten 2 treatments. And then he further stated, you should just go home right now. And I don't feel comfortable giving you any more narcotics. I was in so much pain from my neck. My neck hurt so bad. He made me feel like I was a drug addict. And he knew I was a physician. So I spoke to patient advocate who left me wanting. There's not much I can do. So I started asking, send me to another hospital where they can treat me. And if they're not going to treat me here properly, send me to another hospital. Next thing I know, I'm getting a stat CT of my neck with and without contrast. The CT went down a little bit into my lungs, and you could see new pulmonary infiltrates, new lymphadenopathy all throughout my neck. And all of a sudden, yes, we'll treat your pain. You have to show proof that you have something wrong with you in order for you to get the medicine. I put forward and I maintain, if I was white, I wouldn't have to go through that.
Dr. Moore was discharged from Indiana University Health Facility, and less than 24 hours later, her temperature spiked to 103 degrees and her blood pressure dropped to 80/60. Normal blood pressure is 120/80. Dr. Moore was transferred to a new hospital, but unfortunately, Dr. Moore died of COVID-19. Indiana University Health Facility released a statement in part that said that their nurses may have felt intimidated by Dr. Moore. Rather than accepting accountability for the lack of action that they took for Dr. Moore, they blamed the nurses and they blamed the victim, Dr. Susan Moore. And Dr. Moore was an actual physician who knew her medical health history and knew the symptoms she was experiencing. Wonder if she was not a doctor, and wonder if she didn't know her medical history. I can only imagine how she would have been treated then. So to sum all this up, if you're one of the over 30 million African Americans that desire to take the vaccine, there's a high likelihood that you won't even be allowed to take the vaccine anytime soon. If you're one of the few that are allowed to take the vaccine, but experience one of the symptoms that require you to go to the hospital, you have a high likelihood that you'll be taken to a hospital with a high mortality rate, a low overall patient care rate, and a low overall patient experience rate. And then once you finally get to the hospital, you have a high likelihood of waiting 35% longer than white Americans that come into the same hospital with the same symptoms. And then once you're seen by a doctor, you have a high likelihood the doctor won't believe you, you won't be included with the diagnosis, and that you may be seen as intimidating. Well, that's all I have for today. If you have any questions or anything, please leave it in the comment section. And if you like this type of material, please subscribe to the channel and hit the notification bell so you'll be notified the next time I post another video.